pain in your ovaries, a symptom of a larger problem. If you're a woman, you've surely felt pain in the lower part of your abdomen during some part of your life. Sometimes, people call this ovary pain, or cramps. However, this term isn't scientifically correct. This is because your ovaries are organs that actually don't feel anything. Because of this, the pain that comes from this area is simply a reflection coming from an imbalance or problem at the area and organs close to your ovaries. Following scientific studies, pain in your abdomen, pelvic area is one of the most frequent reasons for gynecologist visits and hospitalization. Among the most frequent causes, we find sexually transmitted infections, STI, cysts, endometriosis, ovulation. Sometimes, it doesn't mean anything severe. However, pain in the area of your ovaries can be caused by a larger problem. Symptoms and preventative measures. To identify the root of the pain, you need to keep in mind factors like the start and location, how the pain affects the area, changes in urination or defecation in your body, menstrual periods or presence of fluid or bleeding, recent surgeries. It's wise to keep a daily log of the symptoms. This information will be very useful for going to your doctor and getting diagnosed. The causes of the pain around your ovaries, pelvic and abdominal. Below, we're going to show you some of the reasons that this pain can appear. During pregnancy. Pain and contractions in your abdomen are common during pregnancy. However, to avoid greater risks, it's necessary to see your doctor immediately if you have hemorrhaging, unusual vaginal fluids, fever, dizziness, nausea, or vomiting. Infections. There could be an infection in your uterus, endometriosis. It could also be due to diseases like chlamydia, gonorrhea, or tuberculosis. However, it could even be a combination of normal vaginal bacteria. Also, it could be the product of birth or a cesarean section, a pelvic inflammatory disease, parahepatitis, an ovarian tube abscess, or even ovarian tube cancer. Attachment disorders. The pain could also be caused as a product of the concentration of fluid in your ovary, cysts, their rupture, or the rotation of the ovary, the tube, or both around its suspending ligament. Ovarian torsion can cause significant pain. Recurring pain. Generally, this appears before or right at the same time as ovulation. In other words, when the egg is freed from the ovary. This pain is known as intermenstrual pelvic pain. However, it can also be caused by dysmenorrhea. In other words, cramps caused by menstruation. Gastrointestinal problems. These have to do with causes related to a digestive system organ dysfunction or alteration. Among other causes, this can be due to gastroenteritis, appendicitis, irritable bowel syndrome, intestinal obstruction. Genitourinary causes. The pain can also come from an infection of the lower urinary tracts to the bladder, cystitis. This is due to the continual contraction during urination. This can also be due to pyelonephritis. This is an acute upper urinary tract infection of the ureters that connect your kidneys with your bladder. Another possibility is kidney stones. These are characterized by the presence of stones in your kidneys or urinary tracts. Musculoskeletal reasons. In addition, the pain may be present due to a hematoma in your abdominal wall. This kind of injury can appear after falls, accidents, or hits. Pain can also happen when there is an inguinal hernia. In these cases, the abdominal wall becomes weak, it breaks, and the small intestine or some other organ from the area sticks through the hole in the inguinal canal. Recommendations. Pelvic pain has certain complications that come with it. Given that it's difficult to diagnose, it requires a deep multidisciplinary analysis. This determines the causes and the best and most appropriate treatment. At the same time, its diagnosis requires immediate attention. A delay in moving forward can have fatal consequences for the patient. Because of this, if you suffer from constant pain in the area around your ovaries, you need to talk to a doctor or specialist immediately.